What's up, guys? Welcome to the PT Good Podcast, where we talk all things ortho, from physical therapy to training. My name's Kane.
And I'm Mark.
So, Mark, what is on the agenda for today?
All right, Kane. What we're going to talk about today is the influence that social media has on physical therapy, the content that we see that's being developed, the impact that it has on clinicians, whether it's new grads, whether it's experienced clinicians, the kind of discussions that are going on, and where we think, or how we think PT social media can affects the profession, whether it's negatively or positively. So, Kane, I don't know how much exposure you have to PT social media, but is there anything that you have come across, or you see any specific trends that you notice, like things that you're seeing recently when it comes to PT and social media?
So, I used to follow PT social media a little bit more previously, but that's kind of fallen off lately. But the trends that I've seen, especially with TikTok, are at least that more skits are coming out about like making PT more relatable, like funnier for clinicians and stuff like that. But then there's also still the same posts that I see where it's like, you have back pain, do these 5 exercises to help you feel better or to get rid of it. Or your clinician is doing this wrong, they should be doing this or this or this instead to get you feeling better, or this is what a good PT would do, which I don't necessarily disagree with, but I think it's usually like how they're going about it and like the aspects that they're kind of criticizing. I think that could be done well. I think it just needs to be done a little bit more, I guess, constructively. For it to be more useful. What about you? What
it's like seen? I mean, so like, I'm not on Instagram or TikTok, so I think like the type of content that I see is different. I'm only on Twitter when it comes to PT, and I've been like following that pretty closely for I don't know, 6, 7, 8 years, and just because of the structure of the platform, like the content on Twitter is so much different. It's really just like, it seems more discussion based, and it's just like a text based platform. People posting articles or posting, their thoughts, and then people replying. But I do see like shorts on YouTube when it comes to like, oh, you have pain here, like this is what you should do, blah blah, stuff like that. And then like I said, I'm aware of the structure of content on TikTok and Instagram, so I can get an idea of what it's like. But I mean, I guess the ultimate goal with, especially with social media in general, is people to get just more interactions with their content. So I guess when people are creating that kind of easy to digest, quickly viewable content, like, oh, back pain, these are the things you should do. People who, someone's just scrolling across, oh yeah, my back hurts sometimes, and then they see, oh, these are the exercises I can do. Okay, cool. Yeah, it's there. It's just like ideas, things to do. Ideally, or maybe not ideally, but we understand that regardless of the type of pain someone comes in, like they need an evaluation is warranted before you can make recommendations. I'm on the PT subreddit too. I'm on there a lot too. And it's like, I mean, one of the rules, you can't give any medical advice. Someone comes in asking a question, the only recommendation is to go see a PT, right? So it's like, I understand why like the content you described is there. I don't know, how much good it does. I mean, maybe it can have its place in that maybe someone does have some kind of pain and they do these exercises and it helps, right? And then if they run into the issue again and they do the same exercises and then it doesn't help, maybe that would motivate them to actually go to a PT. And then they say, oh yeah, I was trying these things and it's not working now, right? And then that opens the door to be like, oh, if you find something that does work for them that's different, they can start to see the value in PT. Like, oh yeah, it's good that initially you're able to get some relief with this, but it's not working now. This is what I think you should do now, just to take care of the problem that you have. But yeah, I'm much more, at least as a clinician, I'm much more interested in the discussion and idea-based content versus, quick 1-minute clip about, these kind of exercises, right? If you're a PT, you kind of know where those that clip-based content's going, right? You understand the goal of it, but yeah, so I think there's more value from a clinician standpoint when it comes to the discussion-based things. Have you like you on Twitter, you see any of that kind of stuff, or the PT subreddit, people discussing different topics, stuff like that?
I have not really been on the Twitter side of things.
Yeah.
I think that that's pretty cool. I think that that's one of the things that I would actually enjoy seeing is like different discussions, opinions, and perspectives about like maybe something that could be a little bit more divisive amongst clinicians.
Sure.
And just seeing like what their, not just like how they would do something, but why and what their justification is and stuff like that. We've mentioned that a bunch in the past, which is like making sure that you have a sound approach and being more systematic when you're coming to your conclusions. And I would expect that these people, when they're stating their opinions about how they may practice or how they may go about doing certain things, are able to justify in the same way. Like I don't expect people to practice and do everything the same that I would do it, like that's definitely not the whole goal or nor my expectation. But what I'd love to see is that we have similar thought processes and the ability to justify it, because that's what allows you to have like that open discussion and be able to like see the pros and cons to one person's perspective and stuff like that. I think that just leads to like more fruitful discussions and an improvement within our field,
Yeah, it's cool. Like at least like some of the stuff I see on Twitter, it's like someone someone posts an article, research article, like, oh yeah, this says this or something, and it's like there's nuanced discussion about it. It's not just like, people aren't just reading the abstract and taking it at face value. Some people break it down. Or the other cool thing too, which some researchers will post on there like, hey, we just got our what do you call it before you have like the article's not published, but you like have it written and it's people can access it. I don't know, like it, whatever it's called before that. But people post like, oh yeah, we have this article, it's done. If you want access to it, just contact me. But it's going to be published in like 4 or 5 months, right? Like I've messaged people, like just DM them on Twitter and like, hey, here's my email. Can you send me this? And they send it to me. It's like, cool. Look, we get this like this up to date research about whatever it is that interests you, and you can be directly in contact with the authors, and then they're open to questions and stuff too, which is I think it's, when it comes to facilitating that discussion, it's cool, because the authors, they're doing this research to get answers to whatever they are studying, and they're always seem, at least in my experience, always happy to interact with clinicians who are also interested in what the research they're doing and whatever conclusions they were able to gather from their research.
And there's also no paywall.
Yeah.
The people who are withholding the research from us.
It's so. I just went to find an article yesterday, and it's like open access, full text, great. And I click on it, and it said it's like full access with $80 a month subscription. I'm like, what is? It's crazy. That's something people discuss a lot on Twitter too. It's like how are you and it's not the fault of the researchers. I mean, they put the time and effort into it, but it's like, why, if this information is supposed to guide practice, why is it behind a paywall? It's so weird. But like you said, yeah, it's cool. Yeah. Like these people, like the people, the authors on Twitter and stuff are like, they literally DM them, email them, and they just send the article over. It's like, cool, perfect, thank you.
Yeah, that is what I found as well. If I was doing research for school or for residency, or like I just wanted to read something, even when I was way younger, you just shoot an email over to the authors. They are not getting a cut. So they just want people to read their paper, so they will be more than happy to send it over to you. Yeah. So I think that's definitely a great way to go about things. Now, do you find that and like I said, I have not been a part of these discussions or really seen them that much, but I know that it can definitely happen in real life too. Do you feel like when people are discussing these articles that they kind of jump to a conclusion too quickly when they read one article that may justify their practice, and they're like, see, I knew it, I told you so, this has to be the way? Or even on the flip side, it disproves what they've been doing. They're, oh my god, I need to change this, this is the way that we need to be doing stuff, and like what I was doing was wrong, and then yada yada yada. Do you feel like people still jump to that conclusion too quickly due to the release of a new paper?
Yeah, that's an interesting topic too. Like, at what point like what amount of information, like what level of evidence, or like when do we have enough information to say that it's going to change someone's current practice? It's hard to say, but I don't find that, at least the discussions that I've seen, like people are like, oh, we should do this differently. It seems to be that they said there's a lot of nuance in the discussion. So people have an article and they will take a topic from an article or quote something from it, and then they'll maybe make a comment about their, not just current practice in general, right? Or like how a certain population of patients is treated, and then people kind of go back and forth, and they'll discuss the article, and then they'll throw in their own like personal experience to it as well, which certainly has value. But I don't see. Maybe there will be something in there about, I don't know. Let's take it like a simple topic, like open chain exercises with, like, after ACL reconstruction, and it'll be an article that says, it's safe, it doesn't lead to increased like re-tear rates in the future, and then maybe they'll quote something from the articles that says that, and then they'll say, oh, we need to do better about doing this for quad strength, something like that. And then people go back and forth. Maybe someone will say, oh, well, this article doesn't say that it leads to better outcomes. It just says you can do it. Closed chain is maybe equal as long as you can do it. And then someone will comment back and say, yeah, but like, if there's a situation where you can't do as much closed chain, maybe they had like a meniscus repair too, and, they have to do open, right? So it stimulates that discussion, but, I don't think people are explicitly saying like, oh, wow, I didn't know this, like now I have to do this differently. It seems, at least, and this is probably because the population of people who are discussing this stuff, I mean, you kind of got to be pretty passionate about PT and have a good understanding of, current practice guidelines if you're on Twitter discussing PT articles in your spare time, right? So, yeah, I mean, there is certainly a discussion about, changing practice and stuff like that, but it doesn't seem that, like people are explicitly saying, oh, I need to do this differently. But, yeah, there's a lot of discussion about, it seems more generally just about how things should be done.
What do you mean by like how things should be done? You mean like changing practices across the board?
Yes, yeah, exactly. Yeah, not like yeah, exactly that, basically. Like, how should I put it? It was very like when I would do, yes, yeah. So like, I started reading this kind of stuff, the PT Twitter stuff, like when I was in my like second clinical rotation, and let's just take stick with ACL. I remember I had a non-op ACL patient. I started doing like a deep dive into that kind of stuff, and I was reading articles about, I knew quad, but then I started reading articles about the contribution of like hamstring strength and glute strength when it came to knee stability, and when it came to like reducing or at least controlling anterior tibial translation in the presence of a partial tear of ACL, stuff like that. And then I saw someone post an article about it, and I started following people who did research on ACL reconstructions or just management of non-operative ACL tears, right? So then that kind of information was able to change my practice in that way, right? But yeah, it didn't. How should I put it? That changed my practice generally, right, within that specific subset. And then another example I had was about, there's an article, it was either 2019, 2020, maybe even a little bit later, just speaking generally about the concept of pain during exercise. And it gave some recommended guidelines for the maximum amount of pain that, you quote unquote should have during exercise, and then, how long, the maximum amount of time something should be sore afterwards, and then like, the acceptable range of pain, your ideal range, stuff like that. And that allowed me just to form a basic set of rules or guidelines that I could work with and apply to patients literally the next day. And then over time, start to develop it into my own little system, right? So if I see a patient presenting with this and they have pain with movement, but it's not worse afterwards, or maybe it's worse for like 12 hours afterwards, but then it settles down to baseline, and then when they come back, it's a little bit better, right? It at least gave me a starting point to be able to develop a little system. Yeah, so that's an example of like how it changed something in a specific way, and then something how it changed things for me generally.
Sure. I do think that tidbits like that are super helpful. Like the ACL one, I think that's great. It's helpful for us to know that we can do these things. I think that there is definitely a disconnect between researchers, clinicians, and then the surgeons, and what we all want and what we can do, and like how that will benefit the patient. I think that there's a bit of a slowdown in that regard. It's just like when a research article comes out like that, say if we stick with the same example of open kinetic chain exercises for following ACL, right? Is when an article comes out, we've had this belief that we cannot do this for the past few decades at this point. Right. And having something that completely changes that or flips it and says, oh, the thing that you said that you can't do at all, it's actually just as beneficial. Introducing it early on. I think that researchers probably want us to make that adaptation faster. And to me, I think that there isn't enough research to like concretely say sometimes that something is something that we believe to be like tried and true to do the exact opposite of that. That I feel like requires so much more evidence to prove it wrong and to actually improve the standard of care that we can give. Like that is really, really tough, especially to make sure that your patients are doing or being given the best care. On the flip side, I think it's even more staunch from surgeons, where they really don't want you to mess things up. They don't want anything to go wrong. So they are much more conservative in regards to their protocol and what they want you to do, even if it comes at the expense of a worse outcome. I don't mean that it's like a catastrophic one, but it's just like it maybe you're not getting like an extra like 1 to 5%. So I think that's definitely an interesting relationship or dynamic between the three different parties, because that really does impact our patient a whole bunch. It also impacts how we should be viewing research or all these like new social media posts, because people are consuming this information within like 15, 30 seconds, maybe 1 to 2 minute clips tops. You're not getting any nuance. You're not critically thinking. You're taking a lot of the information at face value. And I think that is where social media can be definitely a little bit more dangerous when it comes to affecting our practice and the care that our patients receive.
Yeah, for sure. I mean, there's positives to like you said, the quickly, easily consumed content, but it's also, I think you get more reach with that when it comes to just like general population. But the downside is that, there's not much discussion with, right? You're expected to see something and then just take it, like you said, at face value, which, it's the nature of that kind of content, which has its positives, but certainly has its negatives as well. You were talking about, surgeons and stuff like that. Like the one cool thing too I noticed about, like we said, like PT Twitter, but there's a ton of maybe not a ton, but there's a good amount of interaction between orthosurgeons and also like one of the people I follow is a sports medicine physician, and he talks about different cases and scenarios where he would recommend certain kinds of injections and stuff like that. So even like we stick with ACL, like there's a fair amount of surgeons on there that are doing ACL reconstructions, and they discuss directly with PTs regarding graft choices and different regarding different patient populations, and should you go operative or non-op stuff like that. So it's not like the people on, we'll say, like PT social media are just PTs, right? It's the whole ortho base, right? There's chiropractors, you can get a lot input from all kinds of different angles.
Yeah, I wish we had a bigger collective for that. I just think that that is definitely something that we're missing, because like and this may just be in our healthcare, but we tend to practice almost in silos, like we don't actually collaborate as much as we say that, oh, we're your healthcare team. It definitely doesn't work that way. Your physician may sometimes read our notes and skim them at best. And I think that leads to that disconnect, and that definitely makes it a bit of an issue in regards to staying on the same page and pushing each other to do what's best for our patient, and like understanding from their perspective, the physician's perspective, of like why they're doing certain things and stuff like that. It's very easy to quickly like point the finger and be like, oh, well, they did a bad job, or like, why are they still doing these techniques from like 80 years ago, or why would they pick this and that? I feel like it's very easy to point the finger when you aren't facing those job duties and responsibilities, So it's good to have like the other perspective as well.
Yeah, it's helpful. It's cool to see like some of the justifications and stuff made by different providers, like not just PT, but like we talked about different physicians from different disciplines, stuff like that. It's certainly helpful. Do you see any anything like specifically negative that you've, not negative like content based, but any kind of like downsides you could see, like to the, let's say, like increased exposure, like the type of content that you see regarding PT?
I think that there are two things that really jump out to me, to be honest with you. And it is try these 5 exercises to fix your pain, because that does a handful of things for me. The first one is, this is no better than standard practice. This has seriously been a huge pet peeve of mine, where you give someone a cookie cutter thing, your top 5 favorite exercises that you do for whatever it is, and you're hoping that it fixes it. That is hoping. You do not know if you're addressing the correct impairment. You are hoping that your exercises addressed an assortment of impairments that the person may or may not have. And that to me is essentially distilling PT down into, oh, just try a bunch of random stuff and see if it works.
See what happens. I want to add like too, like with the some of the things I see where it's like, oh, the best hip exercises, the best shoulder exercise, this, and it's like, and then that's people's own expectation. Yeah, exactly. Yeah. Like, I mean, I've had people, and I don't know if this is specifically from social media influence, but not even patients, but just people casually at the gym or whatever. Hey, like, what are like the best like PT exercises? Like, what are the best like shoulder exercises I can do if I have pain here? And it's just like, it's not really how it works, right?
Yeah, I hate, like, you know how I feel about this. I hate PT exercises. Like, they do not have to be PT exercises. You just go in and you just lift. You know what you need to move and how you need to move it. That is your PT exercise. But to me, that is just basic movement intelligence. Like, you need to know how your body works for you to like Be an active participant in your rehab, or in your prevention. I think that is just so important. So when people get these, they see all these bands and stuff, that is what drives me nuts, because I'm like, you can just load it, move, and then work on your quality of movement. It doesn't always need to be a band. It doesn't always need to be like super like fancy or complex or anything like that. Sometimes you just need to clean up your movement pattern, and it will get better.
Yeah, it's another thing. Like the sure you've seen online, you talk about bands and stuff, and people will be doing, I don't know, let's take a basic movement like just like a squat, right? And they're like doing it on a ball on one leg with like 3 different kinds of accommodating resistance. They got a band, they got a chain, they have all kinds of stuff pulling them in different directions, and it's like, it looks attractive, it looks cool. It's like, oh yeah, this is like, look how hard this exercise is, and it's like, the real world utility or value in that, like, we know is it's just low. Like, for, I don't know, I mean, if you take something as extreme like that, I don't know, I can't think of like a specific sport where doing it like that kind of movement to that extreme is giving you more benefit than doing it a lot in a lot more simple manner, right? But the idea is that people see that and they're like, wow, that must be hard, that's cool, right? So they're getting views from it.
I want to do that. That looks fancy.
Yeah. It's like, wow, that guy must be really athletic if he can do that. Like the one guy I follow, he does sports performance for golf, and he's big about rotation-based plyometrics, and then just like, explosive lower extremity performance, and then just like lower extremity strength. I mean, upper body as well, right? But he posts a lot about seeing people, golf performance experts, and they're doing, like they doing medicine ball throws on, with like a band around their trunk on a Bosu ball upside down. It's like, how can you produce like that amount of force quickly doing that? It just doesn't, you can't, right? So yeah, things like that, people see them, they're like, oh, this must be what I have to do. I've been doing the simple stuff for long, and maybe it's not helping as much, and they see that, and then they kind of fall into this trap of like thinking things have to be complicated and look cool and do all kinds of like not different movements, but use all kinds of different equipment and stuff just to achieve that goal, when the solution is much simpler. But like I said, like the goal, I mean, it looks good. People click on that. They're like, what's this? I haven't seen this before. And then, they get the amount of kind of interaction views that, maybe they wouldn't get as much if they were to, just post someone doing like a jump squat or something like that with some weight.
Yeah, I think that a lot of times the answer is often the simplest thing, and people just don't tend to want to do that, which brings another thought up into my head. And I actually had this discussion before with a fellow, and it was an interesting discussion to say the least, which we talked about like how there are these top exercises to do for if your back hurts, right? Usually it's some form of like you do a plank, you do TA setting, you do like, maybe they'll have you do like squats or like clamshells, different stuff like posterior chain strengthening type of exercises, bridges, etc. And I was like, we see these all the time. It usually takes 6 to 8 weeks for that to see improvement. Like, we don't actually know if it's strengthening and motor control that's helping them. Maybe it's like reconditioning them and improving their activity tolerance. Maybe it's natural history that's occurring. And I was like, I don't understand why there isn't a page where they just tell people, hey, here are the top few things you can try when your back hurts. Bend backwards.
Yeah. Stretch a little.
Go to your end range. If it doesn't work, if things get worse, go seek a physical therapist.
Yeah.
If things get better, awesome. You just fix your own.
Yeah, we gotta upload we need a PDF of Treat Your Own Back. People can just read it.
Oh my God. Like on it, the thing is, like, the pushback that I got that I thought was very, very interesting was
this is what you're talking within the context of the conversation you had. I mean, you said fellow, you didn't mean like a young lad. You meant like someone who was doing like spine fellowship or something, or someone who had completed it. Yeah. Just making sure. Yeah.
And so the pushback that I got from this was, what if they had a strain of their lumbar erector? You know, to me, I was like, well, we just said if it doesn't get better,
yeah, right,
you should probably seek a medical provider.
Yeah,
what does bending backwards do?
Yeah,
doesn't make it worse.
Yeah. Like you said, the person they'll know if it's worse or not.
Yeah, like, to me, because derangements are so commonplace, it would probably benefit people to understand how we can reduce that. And I'm not saying this as like as a McKenzie fanboy or something, but the fact that people can reduce their symptoms with one motion that has a bunch of different variations that you can try and see if it helps you. I think that is like so powerful, because then they can actually see like quick changes. And this isn't something that takes 6 to 8 weeks and you have to wonder what's actually being changed. This, you actually know, oh, we have a tool. We have at least a management tool. You know, like that to me is like a huge solve for low back pain. It's something that like has plagued our medical system. You know, like, oh, we don't know how to reduce costs for low back pain, or like people are taking off and etc. But it's like no one's ever actually given them the simple solution.
Yeah. I think I forget where I forget if it's Chad Cook's work or not. Chad Cook's work or not, but it was I think he was saying the most cost effective thing for like low back pain was essentially to do nothing, because he was saying people with this kind of pain weren't functionally limited enough that they were missing work, or like or companies were like losing money or whatever, but they were living with it. And maybe if they had like a self-management strategy, they would be able to reduce it quicker versus having to go somewhere to be provided care, which was resulting in like a net negative or a cost to the healthcare system in general, right? So like you said, like instead of just telling people to try stuff, maybe give them a system they could work with. I've seen there's like I'm sure if you go online, if you Google, if you just search like McKenzie exercise for low back pain, it's all over the place. No one's the people who are promoting it, or at least have the most interactions, they're not promoting the system. They just list the exercises, right? They're like knees to chest, laying your stomach, prop up, press up, right? And it's just like they're not saying like at least from the stuff I've seen, it's not like, hey, do this and then see if it works, and then if it doesn't work, do this, and then that doesn't work, go to PT. It's just like, oh, here are the exercises you do for this, and then right, which you and I know that's not how it works. But
yeah, unfortunately, I feel like that is something that could definitely be made, and that may be something that we can work on in the future. I think it's just so powerful to be able to like educate our patients to on how to do that. Like, I've had so many patients that will be like, my friend has back pain, and I told them like what exercises I was doing, and they tried it and they were able to also reduce their pain. I'm like, okay, that's awesome.
Yeah.
It doesn't mean that you're a medical provider, but the fact that something that you did and that someone else did, it was so simple to help at least get the ball rolling. I think that is just so powerful for people to see.
Yeah, for sure.
It doesn't require all these bells and whistles to be effective. And that's the biggest thing is like, I don't care what system it is. I care that you are getting results and that the patient feels better. That is like my ultimate end goal. But that was a bit of a tangent. I do want to revert back to the other thing that I see that tends to be that kind of rubs me the wrong way when it comes to social media, which is the concept of finding a problem when there isn't a problem. It's like, you look hard enough, you will find a deficit. But is it relevant? And I guess what I'm trying to say is making irrelevant things relevant, or pretending like they're relevant.
Like in social media, people making it relevant?
Yeah.
Yeah, okay.
So it's like, oh, so you see when you walk, you have too much internal rotation here, too much external rotation here. Like, this is all being compressed, and we need to expand. We need to decompress it, and that's how you're gonna be able to fix like all of these issues. It's like it doesn't. Sometimes it doesn't need to be like. It doesn't need to have that level of showmanship.
Yeah.
To me, it's just like, maybe some of those deficits are relevant. I'm not disagreeing. But sometimes a small problem is not going to be the root cause of everything and be like that cascade. Does it happen?
Yeah.
Sure. But I would say that for the overwhelming majority of people, that's not really the case. And I feel like that is what kind of bogs a lot of us down. And I know that happened for me when I was younger, because it's like, oh, if I find this one deficit, if I just keep looking and fix this is gonna fix all of it. And that is like never the case. I've wasted like 20-30 minutes in an eval just trying to figure one other deficit out, just to find it and address it and try to see if it makes a change. It just goes nowhere, and that's okay. I think that's a learning lesson for a whole lot of people, but I think it's that type of mentality that really, really kind of hinders our patients and our profession, because it's like, oh, only I can give you this care. Like, no one else can do this unless they follow the same like training or school of thought and stuff like that, which I don't agree with.
Yeah, it's kind of the people who are making this content, I'm sure they mean well, but it's a bit predatory in that, like, maybe they post something like, oh, do you are your shoulders uneven when you sit? Which it's like, I mean, doesn't have to be an issue. Maybe that's just how the person is. They don't have any symptoms. Like, and then you were saying, oh, this could lead to issues down the road where your neck gets tight in this, and oh, your nerve will get impinged, and then like your hand muscles are going to atrophy, like random stuff like that, right? A little bit of fear mongering. You're putting this idea, or at least these thoughts, into the general public's head that this is a problem, right? When you said, like how you said, first off, we don't know if it's an issue. We don't know if it's relevant. Maybe that's just how the person the one shoulder's a little higher than the other, but they can do everything they want to do. They don't have pain. We don't have data that says it's going to cause any issues long term, right? But the way it's presented in social media is that, hey, this needs to be addressed now. This is what you have to do. And there's not an option of, hey, go to a PT if you can't do it. It's like, this is what you have to do. These are the exercises, right? It's kind of, you're really closing the person off in that regard. And also, you are basically lying to them, kind of creating an issue out of nothing, without determining relevancy or if it really isn't.
Yeah, I think that is definitely one of the things that I am just not a fan of, and the same thing kind of goes for a lot of the stuff that I've seen in regards to some manual work, where it's like, oh, do you see, like, this doesn't move as well as this, and I mean, the thing that's made me more skeptical about this is, I mean, I wish that I could say, oh, everyone is doing this and they are doing it honestly and mean well, but to me, I was just like, what is stopping you from just pushing harder on one side versus the other?
Yeah.
And then saying, oh, do you see how much that moves or how limited that is? And I've always been like, I respect my hands. I think that they have fairly good feel. The more that I practice, I would expect them to continue to get better. But the more that I do it, the more that I'm like, I don't really feel anything. feels about the same from side to side. And then I've had other people say, no, you really don't feel this. I'm like, no, not at all. And I'm like, I trust my hands, but I don't feel this. Maybe you just have some hidden talent that I don't have. But that's made me, and this could be a skill issue, but to me, I just lost or the merit that I put onto stuff like that has definitely dropped. And I'm like, it's not really reproducible that much. So I don't know how much stock I can put into it. Is it there? Maybe. But I have a hard time really saying this is the issue. Like when something is stiff, you'll be able to feel it, especially if it's like a different thing. Like if you compare it bilaterally, but if you aren't able to do that and you need to convince yourself or your patient that that is the case, I feel like that is where we kind of get into some trouble.
Which is where that showmanship component comes into, right? You got to be able to, you got to be able to sell it. You got to be able to, it's got to look good. People got to buy into it. It's got to be cool, right? Especially if this is something like online where it's like, I mean, I think about the, like chiropractic content where it's like you have, you're pushing this and it makes a loud crack and this, and, you're using this kind of tool, or like the people, with the, little joint guns, and they, I don't know. You see
the hammer and chisel,
hammer,
bro.
yeah. And this is the thing. The hammer looks cool. The hammer, it's like,
oh, it looks
it's like,
so cool.
It's like clear. It's like the tools are like clear. It looks like they're made out of glass. Honestly, it looks like they're just like solid ice that's not melting. It's like, man, I want that done. That's cool. Look at this person, like, quote unquote, pushing the joint back in. It's getting lined up. They're breaking up the scar tissue. It looks like they're crafting a sculpture or something like that. It's like, that's neat. And you and I are just kind of like, okay. But yeah, it's like, why wouldn't like someone want that? Same with like, I don't know, any other kind of modalities, like cupping, needling, stuff like that. It's like, that's cool. I can't do it on their own. This video or this clip I watched, the person who had it done to them had like a really good outcome. Maybe I'll look into having it done for me, right? It's depending on the state you're in or the provider you see, it's easily accessible, right? You can just go, right? So yeah, I mean, that kind of exposure to those kind of things, it looks good, it looks cool. This video showed me that it helped this person. Yeah, I'll try it out.
Yeah, I mean, I personally don't have any issues with the hammer. So I think it's so funny because I view it in a couple of things, in a couple of ways. It looks cool, awesome. Patients will probably see that and be like, oh, I want to try that. That looks awesome. I think of it the first time I saw it, and even now I'm like, oh, I want to know what that feels like. Yeah. If it is a joint, it's essentially doing a joint mob. So I'm like, okay, this saves your hands. That works. It looks fancy, so patients are going to buy in. You don't have to work quite as hard. You can do mobilization of movements a little bit easier with this. I think that there's like a couple selling points to it. It's not like all bad. It's just something that's fancy and is different, Yeah. Would I use it in my own practice? I don't think so. But would I still want to try it? Absolutely. Yeah, it definitely looks cool to me. But yeah, it's not like I hate on those things per se. It's just I think that there's definitely that component of showmanship where it's like, oh, it looks really, really fancy and cool. Yeah, I mean, I need this.
Yeah, like I just Googled mobilization hammer and I just found this private practice, and they have a whole, they offer, it's a quote unquote therapy they offer, and they have pictures of the therapist, and they just happen to pick a couple patients who are absolutely jacked and huge, and they just happen to be doing it on these people while they have their shirts off. And and it looks cool. They have a whole list here of the credentials of the patients that they've been doing on, like their IFBB pros and UFC fighters and stuff like that. It's like, yeah, cool. It worked for them. It probably worked for me. Like, I look like that guy. Maybe I should get it done.
Or I
But
want to look like that guy, so I need
right,
to get
right,
it done.
yeah. So yeah, it's regardless of the proposed benefit or how it'll help someone individually, like the purpose of that aspect of social media is to get that traction, get that kind of attention. So
Yeah, and I think that that's where it leaves. It kind of leaves our field in a weird space because a lot of the high end physical therapists and clinicians that I see is like they have to have these tools. They have to have like the really fancy cups. You know, some of them are like they're like lit up and stuff like that. They have to have dry needling. Like they have so many different modalities, like red light therapy and stuff like that. And it's just it's a lot of passive stuff that the patient has done to them, and I think that that's helpful for a certain like clientele, you know, like the people who want to come in for maintenance, for a tune up, or they just want to relax and feel better. But for a lot of like problems, can they be fixed by it? Maybe, sure. But it can also be fixed in other ways too. And I think that that's like the point that Mark and I are trying to get across is that if a problem can be easily fixed, we should probably do that. It doesn't need all of these different things.
Yeah, like if someone's coming in and like, let's say we've done the mechanical assessment, they know what to do in terms of like their kind of exercises and stuff just to address what they're coming in for. But, they've gone down that route, they're doing it, it helps, but they want to come in and they're specifically requesting a certain modality and they're just like, I do the exercise, I just want this done. That's fine, right? Like you said, like like tune up or whatever, like, maybe they come in once every other week or once a month just to get some cupping done or needling done, whatever it is. Yeah, I'm fine with that. But if it's like someone who hasn't had PT before and we have the option in that regard to start to shape their interpretation or their expectations of what happens when they come to PT, they're gonna get the self-management component. They're getting the mechanical assessment before, maybe down the line or something like that. Like we introduce the modality type things, but I think if the expectation is, day one, we start doing these kind of modalities and then they start to see this kind of stuff online. And then it's like, oh yeah, this is what PT is. You go and you lie down and they, use the laser, or they put some needles in and then they do the cupping and then they put the stim on. It's like, I think that negatively impacts our profession. And I think, honestly, I think it undervalues us. Like, anyone can buy a set of cups and do it on their own. I don't necessarily think there's a skill component of that. Some of the other modalities, maybe they're less accessible, but like I think it depends on the person in front of us. I think it depends on their history with PT. I think it depends on their relationship to like exercise and stuff like that too.
Yeah, and I guess that kind of ties us into the next point of how do you think that social media has kind of influenced our field? Do you think it's helping move us in the right direction? Do you think it's doing a net negative for for our field, for our patients and their perception of what we do and stuff like that?
Yeah, I don't. It's kind of hard to say. I almost feel like it's neutral. Like I've had some patients come in and I have patients come in and they're like, oh, I have you heard of this person, or have you heard of this PT, or have you heard of this program and stuff like that? And I'm like, oh, like, they learned about this kind of PT thing online. And then like over the weekend, I had someone say to me, so like PTs and chiropractors, like, or he said, so when you're a chiropractor, you're automatically a PT, right? And I'm just like, man, I mean, something's going wrong. I just can't. And then, but he didn't. It's funny because he didn't ask it the other opposite way, right? And it's like, this person's interpretation, who hasn't ever had PT before and has just learned from people talking or online, he thinks that like, our profession just gets lumped in with a profession that isn't completely different. There's certainly overlap, but we function differently, right? And we can function independently. And then this guy, he thinks, anyway, his perception was completely skewed. He was just wrong. And I don't know where he got this information from, but I can only assume from talking to people who are online, right? So I don't know. I wouldn't say maybe the information or the content that's being produced by like people who create content for PT, like you said in the beginning, like some of the like skits or funny stuff. That's, I mean, some of them are really funny, right? But it's only funny to rehab providers, PTs, maybe like
True.
if like ATs and OTs, but like I don't see a lot of like high quality content that is like promoting the value of our profession.
Yeah, I would agree. It's like if I were a patient or like general population and I scroll through these things to try to find a solution, I think the best conditions that it does it for would be like tendinopathies or like just like things that have a loading issue.
Right.
And even then there's no nuance to it. It's just like try these and see if it gets better. So I think like for generalized hip pain, where if you're going to give them, if you work on posterior chain strengthening, it's going to get better. Those are all exercises that are going to help you, period. It's not like super hard. It just needs like the appropriate loading. But things that are a little bit more complex that need a little bit more, like clinical decision making, that is where I think that we shouldn't be giving those cookie cutter things of the top 5 things that you can really do. I think it just makes it like really difficult to like properly navigate unless you've been like trained or that you have at least have a better understanding of it. I don't think that what we do is necessarily like super hard or requires a lot of decision making per se, but it still requires it. And I think that if you have like that background knowledge and you can like rationalize your way through it, you'll be just fine, but a lot of people don't have that. They don't have that background knowledge, or maybe they don't know how to justify things when it comes to their bodies or like how to treat themselves, So I think that is definitely a downfall of social media and how it's been affecting both our field as well as our patients and potentially their perception of what we do and how we can best help them.
Yeah, and I think like something we can do in terms of contributing to all this kind of content is just like you said, it's okay if there's content that's like, oh, these exercises for back pain or shoulder pain or ankle pain, whatever it is, but like a little bit of disclaimer, like, hey, try this out. And this is what you should monitor to see if it's working or not, and how you know if it's working. If it doesn't, you could seek specific individualized treatment from a physical therapist versus these are the best exercises, right? So I think a little bit more discussion in that regard will increase the value of our profession. And that it's like, oh, people see like, oh, this PT said these are the best ones to do. So, but there's no, I mean, why would you have to go to PT if you already know the best exercises, right? What about, yeah, this is what physical therapists can provide. You can get an assessment. You can get an individualized treatment plan, a self-management plan, and then you'll be able to follow up, in this regard to get additional benefit, stuff like that. Versus like, yeah, here's what you do for knee pain, right?
For sure, I would definitely agree with that.
Yeah.
And I think the last thing that I wanna say is I think that this sounds like a series that we can actually start, that we can actually do, because it's not there. People don't really give that type of nuanced stuff. So if we at least start to teach people how to self-assess, how to trial and error, test, retest different things and see if it helps. And so I think that breaking it down for people to see, okay, maybe it's a mobility thing. Maybe it could be like a loading issue. Maybe it's a motor control issue, stuff like that. And then that can help them be able to troubleshoot it a little bit more. And honestly, if the people who are doing these things do that, they are more likely to probably seek out a PT. And if they find a PT and relay a lot of this information to them, I think it does make our jobs a lot easier. You just have more information right from the start. You've already done a whole lot of the testing for them, and even the work of the first 2 follow-ups pretty much.
Yeah, for sure, man. All right. Well, that concludes today's episode of the PT Good Podcast. Remember to leave us a like and subscribe to us on whatever platform you're listening to us on. Follow us on Twitter. Thanks for listening. Hope you enjoyed, and we'll see you on the next episode.
I still love you. Bye.